all types of families in all kinds of ways. But 3 simple words can make all the difference.
Can we talk?
Starting the conversation is the first step to getting help. Learn more at samhsa.gov/families or call 1-800-662-HELP for free and confidential treatment referral.
1 in 3 adults has pre-diabetes. That means it could be you, your dog walker,
on your left,
your cat jogger. With early diagnosis, pre-diabetes can be reversed. Take the
Welcome to the Budget and Policy Committee of Denver City Council. This session of the Budget and Policy Committee begins now.
True. HIAC team.
Good afternoon, everyone. Welcome to Budget and Policy of April 3rd. Welcome to April. Thank you all for joining us. Why don't we start with introductions before we turn over to our many presenters about Denver's migrant assistance. And we'll start with our Councilwoman online.
Good afternoon, Candice de Vaca, District 9.
Thank you very much. And we'll start on my left.
Good afternoon, Robin Knich, at large.
Buenas tardes, Debbie Ortega, City Council at large also.
Kevin Flynn, Southwest Denver's District 2.
Good afternoon, Stacy Gilmore, District 11.
Good afternoon, Paul Cashman, South Denver, District 6.
Good afternoon, Kendra Black, District 4.
Councilman Amanda, District 1.
Joel Clark, District 7.
Good afternoon, Amanda Sawyer, District 5.
Chris Hines, Perfect 10.
Thank you very much. And I'm Jamie Torres. I'm proud to represent District 3. I would like to welcome, is it Jay who's kicking us off? A team is a team OT. David, come on up. Whoever's leading the crew. Welcome, folks. And we're getting a briefing about Denver's migrant shelter and assistance response. Thank you, David.
All right. Well, good afternoon. For those of you who do not know me, I'm David Powell. I'm the Deputy Director with Denver Office of Emergency Management. To kick things off, we're just going to give a quick overview of kind of where we've come with the Emergency Operations Center deactivating recently. So our response to the migrant and asylee influx started in the Emergency Operations Center on December 8th. Before then, we did have asylees and migrants coming, but the influx really started picking up at that time. And that is when we activated our Emergency Operations Center. The EOC activated, and by the end of December, we went from 0 migrants in dedicated migrant shelter to nearly 2,000. So a very quick escalation of sheltering operations. We opened multiple shelters. We had 2 rec centers, a church, the McNichols building, multiple hotels stood up very quickly to assist in this response. Why the Emergency Operations Center was activated, we served over 5,000 migrants that came to Denver. And we were also able to open a reception center as well to welcome migrants coming in and making sure that we were able to get them intaked in a very efficient manner and out to shelters. Additionally, while the Emergency Operations Center was activated, I'm sure a lot of you remember the very cold days we had this winter. So we also assisted with community-wide needs during those cold weather days as well, some sheltering, some warming centers to make sure that we were assisting the whole community as well. We also, in the Emergency Operations Center, coordinate with a lot of different partners across the community to assist with donations, housing, additional shelter options, and just a wide range of services, knowing that it's a whole community effort, can't do it alone, and we really leaned into that in the Emergency Operations Center response. One thing I think that demonstrates the response and the citywide nature of it potentially the best is that we were supported by over 1,400 full-time city employees. These are people that either for kind of their full-time job for this time or just for a few shifts were able to come and assist us with sheltering and emergency operations center and the Department of Operations Center of Human Services, assist in the reception center, but over 1,400 full-time city employees and close to 500 non-full-time, so on-call part-time employees as well. So really a citywide effort. Whenever we open the EOC, it is a citywide effort. We rely on departments from across the city and our community partners. So that's one thing we're proud of. It's really the city coming together to assist. However, we know that the Emergency Operations Center is activated. It's a big drain on city resources. So we work with Human Services very closely to come up with a transition plan to get this out of the crisis stage and start progressing more and more towards a more programmatic approach, something that's sustainable. So with that transition planning, we closed the EOC on March 3rd and then transitioned operations over to the Department of Human Services to lead it going forward with continuing citywide support. So that's a key part of it. It's not just Human Services, it's a continued citywide effort, but they are leading it as of now. With that, I'll turn it over to Jay.
Thank you, David. Just to tack on to what David had, I'm Jay Moran, Executive Director for the Department of Human Services. Just to tack on to what David had said about the staffing, one of the needs we identified fairly early on was that of stabilizing the workforce so that we had a predictable schedule on a 24/7 operation running through the full week. So we've replaced our frontline staff that had been made up of volunteer or redeployed staff from the city and county of Denver by hiring on-call workers, both to provide the direct service work and the shelter management work. The Department of Human Services continues to provide the oversight and direction and guidance along with supports from other departments throughout the city. Atim Otey, who will follow me, and Human Rights and Community Partnerships have been key in that, as have been the host and many other departments across the city, Parks and Rec being a key partner in this effort. So one thing I wanted to focus on was how we're tracking the number of guests we're serving from day to day. Early on, we stood up a Power BI report, a dashboard that we use to look at our processes and the numbers of people we're serving from day to day and across time. So what you're seeing on your screen now is one of the tabs in our workbook comprising the Power BI report. This one is showing our daily census, and it covers a few weeks' time. We can see on the far left a point in time count of the number of migrants who we currently are sheltering, both the number of arrivals on the particular day and the number of actual departures and planned departures for that day. We can see as of the time of the report, and that report was run on March 29th, that we were serving 1,255 guests in our shelters and had served 6,032 guests overall. We see an actual expenditure figure of just under $9 million. Should be noted that that's both a lagging number and is only updated every other week now. So I'm sure Margaret will talk about that more in the finance. Looking at the report as of noon today, we can see that our number of guests being served has dropped below 1,100. And the total number we've served is about 6,164, if I remember correctly. Then if we go through this report by line, we can see on the first bar chart, not only the trend in the number of guests being served, but also where they're being served. And So we break that out by the particular sites that we're using. Non-congregate sites are ones in motels. Congregate sites are in facilities such as McNichols that we have since decommissioned. And we have a contract with a local organization that we're using for a site as well. We do monitor that from day to day for capacity purposes and try and assess where we have extra capacity from a financial management standpoint. We try and capitalize on the congregate sites because we're paying a fixed amount for the use of those congregate sites, and we pay variable amounts based on the use of motel rooms that we're occupying with our guests. The next graph on here shows the change in the number of arrivals and departures each day. So we can see over time, particularly on the far right side of this graph, where we have more departures than arrivals. The departures are in large part based on those who have been reunified with family members in other parts of the country, although more recently we've seen more of a stabilization of migrants arriving where they really have not selected a place to move on to. And so we're beginning to see more who are transitioning into stable housing with the assistance of some of our nonprofit partners. A team will talk about that here shortly. And then at the bottom part of the graph, we can see where we measure the net difference. Where you see a bar dropping below the line, that means we had on that particular day more departures than we did arrivals. So the idea here being that we want to establish some stability, if not see a lower number of arrivals than we have departures, just again from a cost containment standpoint. We move on to an historical census view. This is very similar to the graph we saw previously, but on this particular view, I'm showing what our census was from the very first opening in early December and up until I think it's mid or late January. What I really wanted to be able to illustrate on this one was how we saw this peak at the end of the year, right into the beginning of 2023, where at one point we had 2,319 guests in one of our shelter sites. That number again has dropped to just below 1,100. Matt Mueller, the Director of Office of Emergency Management, oftentimes will show the correlation between the growth that we see in our migrant arrivals and the number of migrants arriving in El Paso, Texas. There has been a close correlation drawn between the two. And there's some speculation and a close eye being given to what may happen when Title 42 expires in mid-May, that may open up for more migrants to present a surge to the number arriving here in Denver. So we keep an eye on that. Again, we can see similarly the number of arrivals and departures. In early January, we saw 271 migrants arriving on one day. Now, what helped us in decompressing the number of migrants being sheltered, and we see that in that steady decline, actually quite a rapid decline following the big surge at the beginning of January, was through the assistance of the state and one of the contractors of the state, we were able to send a number of the migrants through a reunification effort to other cities Washington, D.C., Chicago, and New York being three of the primary destinations where migrants were moved on to. One thing else I wanted to point out, shelter location key. We haven't identified the actual location specific to where the migrants are for the safety of the guests who are residing in those shelters. So we do keep that confidential for now. Here we have a view of the shelters that we have used. Talked about this some already. We have leased space in Southwest Denver that can support up to 100 guests. We have a city-owned site in Southwest Denver that we expect to come online in mid-month, and it will only be available for a couple of months as of now. That's what we know. And it can shelter up to 150 men. And then we have a motel in Northwest Denver and another one in Northeast Denver that if we fully occupied all of the rooms available to us, would be able to shelter 1,170 guests in total. We recently relocated the reception center or welcome center where intake of newly arriving guests passed through and had their information recorded. That had formerly been at the 20th Street Recreation Center. We were able to return that recreation center to Parks and Rec to reactivate for its intended purpose. We've adopted a few rules to better manage both the operation of the shelters as well as to maximize our possible revenues we might be able to achieve through the FEMA Emergency Food and Shelter Program. So one of those is related to the length of stay. For newly arriving guests, and this was something that we actually deployed in mid-February and have put into practice since then. After 30 days, those guests are expected to leave the shelter. And a number of the contractors or agencies working with human rights and community partnerships has been very instrumental in helping us to find more stable housing or to continue to support the reunification of those individuals as their 30 days is reached. Also, for those guests who had been in shelter for more than 60 days, and we had some who had been in shelter from the very onset of our standing up the shelter, we have provided them with a 15-day notice of expectation of their being discharged from our sheltering service. So that's helped, again, to decompress the use of the shelters. We have a couple other rules that we've put into practice. First of all, no illegal activities or acts of violence will be tolerated. Each of our guests, upon being registered or going through the intake process, are provided a set of rules that they're walked through by our staff at the reception center, and they sign an acknowledgement of understanding now. We've also adopted a rule that migrants who've been served in our shelters and then have moved on, but are return of their own volition, aren't granted reintroduction into the shelter system. Just again, as a means of creating some equity for new arrivals and also to dissuade migrants from kind of moving around the country and coming back to Denver for sheltering. With that, I'm going to pass it over to Atim to carry forward.
Good afternoon, everyone. My name is Atim Oti. I am the Director for the Office of Immigrant and Refugee Affairs within the Agency of Human Rights and Community Partnerships. So today, Council, I'm going to be talking about just a little understanding of where we've been from the emergency operation till now regarding our community organizations as well as nonprofit partners. So 3 areas that where we've been engaging with our nonprofit partners and community organizations is resource navigation, donations, and then temporary sheltering. And I will just note, similar to what Jay talked about, with temporary sheltering, we have not listed our partners there because we want to make sure that the locations where migrants have been remain confidential. So there you'll see that we have had various nonprofit and faith communities across the Denver metro area who have supported our migrant efforts around temporary sheltering. With resource navigation, as Jay commented, it's been a really significant role for some of our nonprofit partners to play. Specifically, Papagayo Vive Wellness, they have been funded by the state to provide specifically housing resources either within the city and county of Denver or in the metro area. They've also been contracted to do some navigation for folks that are going on to various destinations that are outside of Colorado. We've also had individuals who have supported community resources as well as just other basic needs. So you see on the list, we have American Friends Service Committee, Casa de Paz, Mile High United Way, and really their 211 system to really just navigate for folks who are interested in staying in Denver for those resources that they may need. Lutheran Family Services, as well as Servicios de la Raza, these are 2 other organizations that have come on, well, one of them will be coming on. They were just granted funding from the state, that's Servicios, and then Lutheran Family Services will also be doing and has continued to do some resource navigation directly in the shelter. And then lastly, our donation management has been really an effort from all of our nonprofit partners that you see listed here. And that's from managing sites of their, where they are, or sites that the city has either leased and or asked for nonprofit spaces. So, and that's to do donation site management, individuals actually contributing specifically for our migrant needs, as well as outreach for donation volunteers. And those donation volunteers have been responsible for collecting donations, as well as the sorting, and then even some of the kind of transport to the various shelters. And now pass it over to Margaret.
Good afternoon, Margaret Daniels, your Chief Financial Officer. So I'm going to talk a little bit about our migrant response costs. As you all know, this was not part of our 2023 budget. And Denver is spending roughly $800 to $1,000 per week per migrant under our current situation. With that, and given the numbers that Jay walked you through earlier, we're estimating that from January to June, actually back to December, we are estimating $17 to $20 million for our migrant response efforts. This is all of the congregate sheltering that was discussed, the hotels, meals, 3 meals a day, transportation both locally between shelters and the reception center, as well as bus tickets and sometimes airline tickets out of Denver for reunification purposes. Staffing is one of our largest costs, supplies and services. For the July to December timeframe, I have a TBD there. I'm going to talk about this more in a next couple of slides. We do have an RFP outstanding for a service provider to step into the role that Denver Human Services is currently providing. Funding sources. So the primary source of funding that we are looking at is the FEMA Emergency Food and Shelter Program. This is a program that has evolved over the last year or so to offer a greater humanitarian effort component of it. It has also recently received more funding from the federal government, probably not enough. It operates with quarterly reimbursements or an advance funding. So for the quarterly, we submitted a fourth quarter of 2022 application for $2.8 million, and that is just for the efforts that we did in the month of December. We are waiting on that application. We're hearing that's anywhere from 6 to 9 months to receive what reimbursements might be coming to the city. I'm a little bit more hopeful about an advanced funding application that we submitted on Friday. So we took all of our projected costs for 2023, as well as our fourth quarter costs, because they said we could include that, and submitted an application for emergency food and shelter. We are hearing from jurisdictions around the country that because of the funding status of emergency food and shelter, that in their past applications, they've received a portion of what they applied for and was eligible. So we are hoping that with some additional funding that was provided through the omnibus bill that was passed in December, that there will be more funding coming, especially to interior cities. In the past, the Emergency Food and Shelter Program has clearly focused on border communities that have been severely impacted. So we are hoping that as this situation has matured, that they are also giving some attention to some interior cities like Denver, Chicago, Washington, D.C., and New York. Moving on, the State Department of Local Affairs provided $2.5 million that came through this council for an award and was approved. We also requested an additional $1 million that they made available on March 20th, and we're waiting for that. Hopefully that is imminent, and we really do appreciate that state support because it's very flexible for us. The state also made some of their ARPA, American Rescue Plan Act funds, available. The city applied for $1.75 million in January. After the application date, they decided to narrow the focus of the award to some of the nonprofits that were providing some of the housing and other types of wraparound services. So the city's application was denied there. And then we will be coming forward with a supplemental request for that first half of 2023. I expect to come before you sometime in April or early May, depending on what time might be available for us to bring that forward. So I mentioned a few minutes ago that the city issued a migrant sheltering RFP, request for proposals, for a comprehensive scope of services. This is kind of everything that the city is performing right now, primarily through the Department of Human Services, for the facilities, the staffing, the services, the food, the supplies, everything is included in that scope of services. We are actually meeting later this week to go through those proposals and hope to have starting on selecting someone and starting contracting pretty soon. So again, we received the proposals on March 20th. We're working very quickly to try to get to a date where we could actually start a contract in June or July. And that's why you have seen us bifurcate sort of the year-to-date numbers that I mentioned earlier that will come forward with the supplemental as well as the contract itself, which will include additional dollars. So at that point in time, when we bring the contract forward, we will be coming forward with what our proposed funding plan is for that contract. So our next steps with City Council include, as I mentioned just a minute ago, that supplemental for the year-to-date numbers for 2023. That will be end of April or early May, and then contingent upon our ability to get through the contracting process with an award, that will likely be toward the end of May, where we'll be coming forward with the contract, creation of a special revenue fund, and the funding proposal for that contract and the special revenue fund. And that is the end of our presentation.
Thank you very much, Margaret. Team, Jay and David. We also have Angie from Host and Evan Dreyer. Thank you from the Mayor's office here for questions. We'll start with Councilwoman Ortega.
Thank you, Madam President. I'm not sure who to direct the question to first, but what are we doing to assist people with legal resources to help them with their status? Can you talk about whether or not we're funding that, or are there other entities that have stepped forward to help people so that as we're trying to help them to work, they're able to work with legal status?
Yeah, that's a really good question. Thank you, Council Member. So it's a mix. Our Denver Immigrant Legal Services Fund is helping individuals who are making Denver their home, because we do have the requirement that you are a Denver resident. However, many of those grantees are still kind of going outside of or finding funds from their organizations to assist migrants. So those of Catholic Charities, Rocky Mountain Immigrant Advocacy Network, JAMLAC, they've actually been holding Know Your Rights presentations where they're also connecting with the American Immigration Lawyers Association of Colorado, chapter of immigration attorneys, that are offering pro bono services to explain to migrants their rights, immigration-related rights, but then also do some individual consultations. It is a little bit of a arduous process to get into an asylum application. So I will say that there's an initial discussion, and then the idea is that they would go on and complete the applications with those organizations.
So are people coming to them where we have them gathered, so it's not them having to go to a place where they're scheduling one-on-one appointments, or is that comes later?
That actually comes late. Well, it's both.
Okay.
We've offered a lot of resources through the nonprofit partners, but we've also utilized our Plaza program with Denver Public Library to serve as another resource, as well as 211 that I mentioned. Okay. So we've actually been utilizing some of our libraries as what we've called community resource sites. So at those sites is where the legal service providers are going and offering their services. And then along, that initial connection is the hope is that they'd actually go and do some individual work.
Great. So I want to ask Margaret my next question. So it looks like what we've applied for or what we've received is about 7 million, correct? Out of the 17 to 20 that we're going to expend. So my question is, where will that money, where is that coming from? I know so far it's been the general fund, but at some point we're not going to be able to sustain that. And I'm just wondering if you all are beginning to look at what the plans are to look at. Are we looking at cuts in some agencies? What does that look like, sort of thinking through, and we're all keeping our fingers crossed that the applications will be successful in securing more dollars. So part of that question is, how much total have we applied for, knowing that, just heard what you said, some other cities are not getting anywhere close to what they're asking for. But I know it's a lot of questions there, but thank you.
Let me know if I miss anything. So we have applied for $2.8 million that is in FEMA's hand. That's for that December timeframe. Right. That has a long time frame for us to probably hear back. We have received and been awarded $2.5 million from DOLA, the state, and have another request in for another $1 million. So that's $3.5 million that I do expect us to have or have been awarded, or the additional $1 million expect within the next week or two. The other amounts, so the contingency that I mentioned that will be coming toward the end of April or early May, as you correctly stated, is from the general fund. This is the budgeted contingency amount. So it would just be drawing down from what we've already budgeted for contingency, not for a specific purpose like this. So that's where that will come from. And then.
And that was the 1.7, correct?
So that's the 17 to 20
The
million.
total amount. Okay, got it.
Yes. So and currently we're funding operations just through agency budgets, so that when the contingency request hopefully is approved, that we could sort of backfill those agencies that have spent money on operations to date. The second half of the year, where we would have that contractor in place, that's when I would be coming to you with a financial plan for that contract. Hopefully it will include advanced funding, because we will hopefully hear by the end of May whether our advanced funding request for emergency food and shelter has been approved and to what level. But then we've got some other ideas as to where we could provide the balance of the year's funding that do not include budget requests or budget cuts. It would be moving around some other items that really be focused on areas that do not impact city services. Of course, this is all reliant upon funding from others, and that you sort of remain at a level of arrivals that are not exceeding what we're at now.
So my last question, and you may be the right one to answer this, is whether or not we have employment navigators, somebody helping them as their legal status is established, to assist in getting folks connected to employers, to skills training that helps stabilize them. And I mean, for me, this sort of stretches also into our unhoused population that are in other motels, some of our shelters, because those dollars will also be running out at some point. So what is our exit plan? I kept asking Britta the same question, so that we at least have some kind of plan that works for them, but that works for the city as well.
So I'll answer the employment question. So migrants, when they come to the United States, in the various ways that they come, they are not automatically employment eligible. Right. So you've got to actually apply through the United States Citizenship and Immigration Service. So that is a challenge. That is not an automatic process. It's a very long process. It can take up to 8 to 10 months to apply and then actually receive that employment authorization. We've discussed within HRCP, job training, and we've also worked with DIDO to look at what the workforce centers may be able to offer, in terms of job training and skill training. But actual employment opportunities is going to be a little bit of a longer process because of the, unique processes that they'll have to go through to actually be work authorized to work lawfully in the United States. So that is, it's unfortunately not something that we can, solve or even address, because it's not an issue, or it's not a situation that we can provide at the state level or at the city level. It's actually a federal process.
So given that it's been a little while, so it's 8 to 10 months before we can address their legal status, before we can help train them, get them connected to employment.
The training actually is something that my office and others in HRCP have been working on, because the training, there are some training opportunities where employment status is, or employment authorization is not required. It's the employment that is the challenge.
Okay, thank you. I have no further questions. Thank you, Madam Chair.
Thank you. Councilwoman Black.
Thank you. I have a couple questions. The first is about the migrants. Are they at risk of being deported?
Yeah, instead of sitting and getting up. That's, I think, a question that I can't specifically answer. depending upon the type of protections that they are applying for, that they might apply for, it really just depends on their case-by-case situation as to whether they are able to apply for protections and whether they have those protections.
Okay, thank you. And then Margaret, just following up on some of the questions Councilwoman Ortega was asking, you said something about the second half of the year anticipating the same number, or you're basing your future casting on the same number of people. And do you think it will cost less than it's costing now if we're going through a service provider?
That is our hope. That we always hope to do better than we're doing now, both in terms of costs, but also, at least equal or better services that we're currently providing. I can't say a whole lot just because we are in procurement right now, but we're sort of basing our projections on at least what we're doing now or better for the second half of the year. So.
And you think that you can come up with that many millions of dollars just from different sources?
We do. We've had a lot of planning discussions, both internally with the Department of Finance, but also with our partners at Human Services, as to some areas, and the Mayor's Office, as to sort of making sure that the city's response here, first of all, we're pursuing every avenue and pot of money available to us for this activity, and we'll continue to do so. But that also we are making sure that we're containing operations to a level where city services and city staffing is not implicated here.
And I think we're anticipating a change in federal law, so are we anticipating more people are going to come?
I think we have built some of that into our projections. As you saw on the census data, we've actually seen a pretty dramatic drop more recently that I think we were projecting at a higher level. So we've already seen a little bit more benefit with recent activities just by implementing some of the rules that Jay pointed out with the length of stay primarily. But, it's really hard to project what's going to happen. This is an issue that takes place thousands of miles from Denver, but has impacted the city greatly. So we're continuing to have great conversations with both our state partners and some of our federal partners to really understand it. And David Powell alluded to it earlier. We've got also a great point of contact in the city of El Paso, where a lot of our arrivals are coming from. So we have a few days warning as to what's going on there.
Okay, and my last question is just, I think, general information for anyone who might be watching, but will this in any way take resources away from city services to people who are already here and maybe unhoused?
No, and we've had extensive conversations with our partners at the Department of Housing Stability about understanding what primarily our length of stay policies might do to the homeless shelter system, because we do know that that system is also stretched, and especially during the colder months that they were near capacity. I think numbers to date have not caused a critical issue, but it's something we're keeping our eye on and making sure that they are separate systems, but there may be some intertwining of populations at a particular point in time. But I think at this point in time, we're not seeing anything dramatic.
Great, thank you.
Thank you. Councilman Hines?
Thank you, Council President, and thank you for the presentation. You kind of mentioned the butterfly effect. If a butterfly flaps its wings, there's a tidal wave the other side of the planet. Something that has started thousands of miles away is now impacting the city of Denver. A few constituents have asked me why we're closing recreation centers for migrants. And their justification is, we own a lot of land in the city, so why didn't we, use somewhere else? So I guess my question for you is help these constituents understand why we don't have extra available space for migrants, and perhaps the scale of, we had 5,000 migrants that appeared in the span of a month, right? So perhaps you can help me explain to the constituents why we don't just have space lying around.
Certainly. I would start by saying that the two recreation centers that we did use was really in the face of an unprecedented and unpredictable level of incoming migrants. And so we had to reach out to what we had available at the time. And decommissioning the use of two recreation centers in Central and Rudy Park was seen as the most prudent and expedient way to address that emergent need. We have since returned both of those recreation centers to their intended purposes. And at the beginning of April, we pulled out of the third recreation center that we had been using for the Welcome Center or Reception Center at 20th Street. So at the present time, we're not using any city buildings as shelters. We had been using McNichols building, but we had stopped using them at the end of March. So now all of the recreation centers that we had been using have again been returned to their intended purpose.
Yeah, I guess in some ways I'm answering my own question, but I would say we also know that the McNichols and the 20th Street shelter are up to code. They're ADA compliant as they need to be, and so I mean, not that the folks from Venezuela know about the Americans with Disabilities Act, but we are in America and we know the Americans with Disabilities Act, and so I would also kind of posit that that we know that these buildings that are open and available to the public are accessible, and we know that they're fully up to standards. We can't just demothball a building somewhere else and say that it's immediately available for migrants.
Yeah, I would respond by saying at the point in time that we did activate the two recreation centers as migrant sites, it was really in response to something that we didn't have a clear line of sight in terms of the volume or the extent of the need. And we're really happy that we only had to use them for that purpose for a little bit more than 3 months. And we're relieved to be able to return them to their intended purpose.
Yeah, thank you. As we've had conversations with our state and federal partners about funding, this is a two-part question. Do we also have conversations with those counterparts about a statewide or national approach to, first, migrants and refugees, and second, housing for the unhoused? And I don't know if you're specifically the right person to talk to, but I know that I did ask a couple years ago some national consultants if the federal level had palate to consider a national approach to housing, and the answer was no.
But I've not been part of conversations at the federal level other than in a very narrow perspective. But I know the mayor's office has been involved in those conversations, along with conversations with the state and the federal government. In the very narrow perspective that I've pursued with the mayor's office, it was in looking for other federal funds outside of FEMA that might be available to help support this effort. And the two programs that were identified at the federal level are both administered at the state level. We've pursued each of those angles and are still waiting to hear back. But I wouldn't anticipate that we would see any significant financial windfalls from either of those. In terms of federal policy on those, I really haven't been involved in conversations.
Okay. Last question. Based on the news report, the news reports that I read, I don't know anything special. It seemed like the migrants got off the bus and immediately went into one of Denver's shelters, maybe the 20th Street shelter. Considering, the comment about whether the migrants may or may not have protection and the uncertainty of whether they might get deported, does that make migrants reticent to seek shelter? And were they so unfamiliar with the American structure that they didn't even think about how they might get deported? I know that's a speculative question, but.
Do you mind, Council member, can you kind of rephrase the question?
Yeah, as an answer to an earlier question, we're talking about some people are reticent to use services because of they might fear they're going to get deported or have some interaction with enforcement here at some level of government. The news reports that I saw, it was almost like the migrants came off the bus and immediately went into processing. It was like we knew that they were coming, we knew why they were coming. So we just, while they were confused, we just immediately started processing the migrants. But maybe that isn't the case. Maybe there were some folks that said, I don't, can you let me off 3 blocks early because I don't want to have any sort of interaction with government because of fear of, enforcement action or deportation.
And so, I'm sorry, the question is.
I guess maybe I'm just.
Can I jump in on
yeah,
what
go for
I'm hearing? Were there folks that evaded the welcome, like the reception building, because they were afraid of asking for resources due to their status? And would you know that?
I don't think I would know that. Yeah, there's a long process from folks entering the United States from the border, coming all the way up to Denver, if that's where they chose to go. But I can't speak to an individual's these were commercial buses, so I don't know if they actually would allow someone to be dropped off earlier or not. And folks have a choice whether to accept our services or not. I can say that much.
I don't know if that captured your question.
Yeah,
okay.
Thank you. That's more eloquent than I could have asked it. And then these are commercial buses, as in who paid for the ticket? Do we know? It's just some magic. They just.
Unfortunately,
okay.
I think that's not something that I could speak to.
Okay, thank you. Thank you, Council President.
Thank you very much. Councilwoman Sandoval?
Thank you, Madam President. Just a few questions. Where did the 15 days come from? That we will only provide services for 15 days? So in this slide, you have.
That might have been one of Jay's slides.
It says, it says length of stay, 15-day limit.
Yeah.
Where'd that come from?
Well, that was only for those guests of ours who'd already been with the department in our shelters for 60 days. So they would have had access to reunification services and the array of nonprofits that can help in stabilizing the arriving guests for 2 months prior. And so 15 days was set as kind of a stopwatch, if you will, for how much longer they could stay in shelter. So they would be provided shelter services up to 75 days as a consequence.
So then where did the 30-day limit come from?
30 days was associated as much with the FEMA emergency food and shelter limits by which they would allow for reimbursement of expenses. And Margaret might be able to speak to this more concisely or accurately than me, but my understanding is that the funding provided by FEMA is only available for migrants that are served for up to 30 days. So we were just trying to capitalize on the availability of FEMA emergency food and shelter. Margaret, do I have that accurate?
I think that's fine. I'm fine with that. But if we're saying that as migrants come into Denver, they can't get jobs because we just heard it takes about 9 months. So they can't get jobs. They no longer can get served by Denver. So what are we telling people? Sorry, like we can't help you anymore? Like, I don't quite understand. I understand that we can't get reimbursed. I get that. But also at the same time, people can't get work for 9, 10, 12 months, depending on the federal system. So what are we telling people? Just because it seems like after 30 days, we're putting people on the streets, which puts people in our shelters because they're not using these resources. They're going to, so explain this process to me of how are we helping people? And like 30 days, it seems like a long time for us, right? Because we're bearing the costs, but coming from a whole entire different country and reestablishing yourself, 30 days is a blink of an eye. So how are we in that 30 days? What are we doing to ensure that people are safe and we're not putting them on the streets to impact those who are experiencing homeless shelters?
Well, in part, that's through the array of services being provided by the nonprofit partners with whom ATEAM and HRCP is.
I get that, but be more specific. So in your experience, are you seeing success in 30 days? That's what I'm getting at.
Well, to address the one concern you had about the potential impact to the homeless shelter system, that was something clearly expressed by Host as we implemented the 30-day stay limit. And that has materialized nearly to the degree that we had feared. And part of that is as a consequence of the interventions being provided by some of the nonprofits who've actually found housing for individuals and families. In terms of employment, we know that a number of our migrant guests are in fact working and are being paid by cash. And we're working with Human Rights and Community Partnerships, and specifically the Office of Financial Empowerment and Protection, to establish some pathway to banking for those individuals who are working.
So are we finding success after 30 days? I know it's not a yes or no answer, but I'm asking you to get to more of a yes or no answer. I live in the policy world, and oftentimes people will say, do you support this policy? And oftentimes it's really hard to provide a yes or no answer because the devils are in the details, right? In your experience, are we having success with housing people and giving them the services they need in 30 days?
I think, as you pointed out, that's a very nuanced question, and I would have to give some thought into how we would actually measure what would be defined as success.
What would you define as success?
What I would define as success is someone who can live independently from the supports that are currently being provided. That said, being the director in human services and working in that world for the past 40 years, I know that there's large swaths of our population, better than 1 in 3 in Denver, who are reliant on some kind of support from the city and from the Department of Human Services specifically. So again, I'm a little bit challenged to define whether those who have been subject to the discharge are finding success. Also, it's a policy that we really only instituted very recently. So we're only about 2 weeks now into this discharge of our migrant population who's reached that 30-day limit.
So that's my concern, is that prior we had 60 plus 70, 15, so 75 days, right? Which seems like, as an adult, like, okay, I can get it together. I had a couple months, I've gone through all the trauma of even getting here. Like, no one's talking about the trauma of the experience of them getting here first, and like that in itself is a whole separate bucket that we're not even talking about, right? Like whole child wellness, a whole adult wellness. So that is my concern, is that if we look at the 75 days compared to 30 days, we've given people who were here on the front end more opportunity to get grounded, get acquainted, figure it out, and start navigating our program. Where our 30-day, I'm just concerned that in 30 days, is if I were a mother going to another country with my children and I only have 30 days, I would be hard pressed to figure that out. Like, honestly, it would be, put yourself in that situation. Say we had to mad exodus Denver and we had to go somewhere else, you and your family, and we only had 30 days. And so I'm hoping that we can figure out other resources or support our nonprofits. A lot of time I feel like even through COVID, we leaned on our nonprofits so much that we're depleting nonprofits. They're going away and they do not have the resources and do not feel supported enough to do a lot of this work. And I've talked to a lot of our nonprofit who are helping in this work, and they do feel that way. They feel like all nonprofits through what's happened since 2020 are being pushed to limits that they don't understand. I think we as a city are being pushed to limits we don't understand. Mm-hmm. We're having to deal with things we never saw on the horizon. We never saw a worldwide pandemic. We never saw the shutting down of our schools. We never saw shootings at one high school within 30 days. I mean, all of us are being expanded way beyond our resources, right? And that's when I feel like we have to really think creativity, be creative, but also really, really, really support our nonprofits. Because I keep hearing that our nonprofits, and I'm afraid that at one point our nonprofits aren't going to be there anymore to do this work for us because we're leaning so heavily on them. And I don't think there is a silver bullet. I don't think that there's just a simple answer to this issue. I think that we are feeling down the trickle effect of what's happening at the federal government and what happened at the federal government prior to all of us even getting elected. This was not something that happened when I got elected in 2019. This is because of a trickle down effect from many administrations ago, right? Mm-hmm. And so now we're feeling the impact. No one's going to the federal government and making them deal with this crisis. They're having to hear from us. So however we can be supportive of our nonprofits, but that's why we have city resources. We opened up our city resources so that we were not leaning just on our nonprofits, right? We opened up our city rec centers because they have permits, they have fire codes, they've actually met criteria that exists in our building department that we don't know if nonprofits have. And then we close a nonprofit because we go to shelter people there and they don't meet the building code. They can't meet the fire department. They're not sprinklered. And then you open up a whole nother can of worms for the nonprofits who are actually trying to do good work and step in place. So I'm not trying to hound you. I'm just saying that I think that a lot of the talking points of what I've heard in the media make it sound like this is a simple solution and what we're doing. And I just wanted to get to the nuance of what does success look like? What does that look like for a family and how are we supporting them and how are we supporting our nonprofits. So thank you all for the work we do. I don't think it's been easy. I think that we're navigating in uncharted territory. Since my term in office, I've worked for the city since 2012. I've never heard uncharted territory, navigating unprecedented more in my life than I have since 2020. It's daunting, as for all of us here. So thank you, Madam Chair.
Thank you. Councilwoman Kinich.
Thank you very much. Really important conversation and acknowledged very much. I guess I want to start by saying thank you to each of you. I know that many of the agencies were deployed in the EOC again, including over holidays, and it's not easy for you as individuals and for the many city staff who stepped up. And I just want to say thank you for those who put in those extra shifts and the sacrifices involved, for those from the agencies outside the city who stepped up. So just to acknowledge that first and foremost as the human beings, and we know that you are all individuals who did that. I guess I would like to step back a little bit from the details and to the big picture. While we did step up as a city, I think in retrospect, I think we learned that maybe we took on so much as a city, we might have maybe missed some opportunities for that collaboration that some cities maybe got to a little sooner. I learned a lot about Chicago's model in some phone calls and some meetings I've had with that city in terms of how they maybe did a little bit more of a partnership model. And we now are moving to this RFP, but I guess I'd like you to talk a little bit more about what you think the roles are. So the RFP is for a partner, and DHS will be a leader in the response. So I guess I guess I'll frame a couple questions, but I'll give you the chance to kind of speak to it a little more in depth. So will we be, one role of the city with an RFP partner is like contract compliance, right? But we, for example, might still consider ourselves a convener of a broader set of nonprofit partners who might have roles beyond just that one contractor, for example. That might be a role we might consider ourselves in. I would say I'm not sure that we're doing that now. I know that we had a meeting or a recent meeting with a group of nonprofits who are interested in playing a broader set of roles. Maybe some of those nonprofits might be subcontractors to a future partner. It's possible they might have roles with or without funding, but I do feel like I'm interested, and I think the community is interested in a more collaborative set of relationships. And I don't know that the contract is the only way that those relationships can and should be defined. But I don't know that that's how you are seeing it. And so I guess I want to hear you describe a little bit about whether you think we're headed into a place where there can be more regularized communication and partnership beyond just the formal relationship of city and contracting partner. And so that's kind of the conversation I'm hoping you can talk with me a little bit about. And I want to just say this, it's not because there are reasons why I'm asking this. I'm asking it because there are things that sometimes are more expensive or difficult for us to do than they are for our partners to do. It's because sometimes there's things our partners are better at doing, right? They are more nimble sometimes. We have some very complicated and difficult indemnification clauses and things that, have been barriers to using certain spaces that perhaps if partners are in the lead, those spaces become easier to use. There might be places where they might have more community trust, right? For example, for the individuals who are extremely vulnerable that we've been talking about. I prefer to refer to them as people. I don't love some of the messaging in the PowerPoint, I gotta say. Not always people first. We try to say people experiencing homelessness. I'd prefer us to say people seeking asylum, maybe more so than some of the language in the PowerPoint. So I'm gonna say people. Maybe people first language, but But anyway, so I'm going to invite you to talk a little bit to the questions I'm asking about where you see our role and whether you see it evolving to a more collaborative convener role, whether it can be rolling, and more so than just this contract.
So I will take a stab at responding to that, and it's my response may not represent that of the
if others
city
want to chime in, I'd love,
but let me offer this. When David earlier had talked about the decommissioning of the Emergency Operations Center, he mentioned this response becoming more programmatic intent. That, I think, conveys a lot of what I'm thinking is the approach going forward. This isn't something that we will resolve. This is something that will be with us. When I tried to draw correlations between the oversight of a contract and a program through the human services lens, what first came to my mind is the comparison with our management and oversight of the IDD mill levy for people with intellectual and developmental disabilities, where we have a program manager and 3 staff who are working with a constellation of contractors. We have a lead contractor in Rocky Mountain Human Services, who you all know having to approve their contract annually. I would see something evolving over time that would look somewhat similar to that, where we would have specialized staff and a program manager who would oversee not just the contract relationship, but the program management. One thing that without going into any of the details of the RFP until it comes forward to you, but just reflecting again on our own experience in standing up and responding to the influx of migrants, none of us had the experience of being able to address that. We did our best to stand up, and I think we did an admirable job. So I appreciate the gratitude that you expressed earlier, because we all really work very hard across a number of departments to do what we have. But in reviewing the RFPs, what I found in the responses is large internationally scoped organizations who have stood up in responding to similar types of crises or emergency situations. People who are organizations that have that experience and the expertise to be able to deliver across the wide level of services that we're providing currently, and really going beyond some of the scope of what we're doing already, simply because of the experiences that they've had themselves. I would invite Akeem if she wants to add to that, if you don't mind.
I would also just add, thanks, Jay. We've been meeting, so my office has been meeting with nonprofit partners who have been in shelter, as well as just others who are interested in helping in either donation management, with donations, faith communities. So I would say that I do think that there is continued opportunity for collaboration. We meet every Tuesday. It is an open meeting. We have the state, the Office of New Americans that come to really understand what we're doing here in Denver. We've had Aurora come to pull from best practices. And, you know, Councilmember Sandoval, I do hear you when you say, you know, nonprofits do need that support. We've tried to reach out to philanthropic entities to support our nonprofit partners, and really try to find any other resources that we can utilize to support our nonprofits, if it's grant funding, grant opportunities. But we've really tried to use this Tuesday meeting as an opportunity for that communication. And, you know, we've heard feedback from our nonprofit partners and our faith community about ways that they would like to see our collaboration more. So I would say that I do feel like there is opportunity for collaboration, and we welcome it, and we'll continue to do that.
I really appreciate that. And I think I hear you, and I agree that when you're responding to something that's so large and quickly forming in such critical conditions, right? Cold weather, people who don't have proper clothing, and there's a real life and safety situation, you know, the response needs to be life, health, and safety quickly. And I agree that the admirable effort was really very appreciated. So very much agreed and appreciated. I think that what I will say is that the scale and type of organization who might be chosen for an RFP at this level is definitely, and again, they may have subcontractors and those who may be doing pieces of the work with them. No idea what structure will come, but it may be that there needs to be maybe the word I'm looking for is input. There may be another place where input from the broader community there needs to be a space for that to occur. And I just want to distinguish between what you described, Jay, which is kind of a government departmental structure, and then what you've described, a team, which is more of a communication input gathering communication structure. They serve different purposes, and so both might be necessary, right? One is an effective structure for administering a program, and we need that because you need accountability and you need a way to keep books and make sure contracts are administered appropriately and government dollars are reusing and contracts are being appropriately implemented. But what is important is that even with an important nonprofit partner in place who's skilled and knows what they're doing, we don't want to lose the ability to learn from a broader network of community partners and expertise in the community that might see things we're missing, or even that nonprofit contractor is missing, or gaps. They will not be able to do it all. And to the extent that our system approach needs input on an ongoing basis, because there will be new challenges, there will be new legal landscape changes, there will be changes in the political legal landscape, and who knows what will happen in the future. We already know what we don't know will come again. And so that system of communication and input will need to be bigger than just the contracting relationship. That's the main point I'm hoping that we can agree on, that it can't just be framed in the department and it can't just be framed in that one relationship. I don't know enough about the Tuesday meeting to know if that's enough. So I just hope that there's that mechanism so that it continues to be built out, because I do think that we won't be able to serve all the things that have been discussed by my colleagues before without that continuing to grow and be able to maintain even with this new partnership in place. Thank you very much for hearing me out and for the dialogue. I really appreciate it. Thanks.
Thank you. Thank you. I've got one colleague and myself left in queue, and we've got about 13 minutes left. Councilwoman Gilmore.
Thank you, Council President. Really appreciate the conversation this afternoon. And Margaret, I think this question will be for you. Went back and looked at the mayor's 2023 budget, and the annual general fund contingency was budgeted at $32.5 million. Appreciate all the work that you and your team have been trying to do to cobble together some funds. It's not going to even make a dent in the costs that we're looking at now. And so we had $32.5 million allocated. It looks like we're going to have 17 to 20 million in expenses. That takes us down to a balance of 12.5. There's been other items. What is our current balance in the general fund contingency today, taking out that 20 million?
So we have not come forward with a supplemental yet. So
I understand
we have the full
that.
amount available. So
But if council approves it,
right,
where will we be sitting?
Right. So it will be whatever we come forward, the 32.5 minus whatever we come forward to. So wherever we sort of settle in on that period's costs, which we're still accruing right now. So We are expecting it to be, around 60% of the available contingency right now, so that we do know that the balance of the year, we've got other needs beyond just migrant assistance. So that is where we're doing a lot of projections and planning there. So.
Okay. And so, let's say if council approves the supplemental, we'll, June 1, have a balance in our contingency of $12.5 million. We don't know what the future will bring. There's some predictions that we might see more folks coming to our city rather than less. I know you're all managing this, but where is the conversation around looking at the undesignated fund balance? And just that we're going to have city services along with caring for other folks who are in great distress and need our help. I guess, where does that conversation lie today? Or you're looking at everything? Are there other pots of money out there that our nonprofit partners might be able to apply for rather than the city and county of Denver? So I know there's 2 or 3 questions there, but try to just keep it concise.
I can assure you, we have cast a very wide net looking at everything that's within the city, as well as, tap some of our state and other nonprofit partners on the shoulder to see what might be available there. As far as the undesignated fund balance, there are rules around how we might go after that. So at this point in time, we are not looking at fund balance for funding this situation. We do think that, if everything stays sort of within a range, that we think we're in a position to be able to cover, the second half of the year in other ways, and we'll promise we will come forward with that financial plan when we bring the contract forward that does not impact city services.
Okay. All right, great. Appreciate again the work that the team has done. Kind of landed on us, and so just thank you for walking through at least what we're looking at as far as a deficit. So thank you, Council President.
Thank you very much. Jay, I'm not sure if this question is for you real quick. We've got about 8 or 9 minutes left. The 1,400 city employees who worked on the response, are they all returned back to their positions? Or do we still have a number that are working in the shelters?
All of the workers in the shelters now are on-call employees, so we don't have any shelter workers comprised of city staff. Now, we do have support staff working outside of the shelters that are supporting the operations.
Okay, and how many on-call do we have online right now?
I had actually requested that information.
You can get it to me later.
I think it's around 200. Does that sound? Yeah, I think it may be 200, and might check my phone before I leave and just see if I'm close.
And is it contemplated that the RFP would pick them up to continue response?
That wasn't set as an expectation, although some of the responses did indicate some possibility of doing so.
Got it.
But it wasn't a requirement.
Okay, thank you so much. And just have a couple comments for the whole team. One, just also want to share my thanks. Migration's not new. We all know that. Denver receives immigrants every single day, and did so before December 2022. But this was different. It was a crisis moment. And I'm incredibly proud of how you and all of our city responded. So thank you so much. I was in a Teams role before coming to council, and I can think of no one better to be directing the Office of Immigrant and Refugee Affairs for the city of Denver. So thank you, team. To the 1,400 city employees who plugged in, this was a big ask, and we heard from several who were overwhelmed with the honor of being able to serve and support families who had been through months, if not years, of things that we can't even imagine. So To all of them and to the on-call folks, I thank them greatly. And to our nonprofits. This, I think, was an opportunity for me to see how the rest of our city was responding in donating and being so generous of new, gently used items. I saw kids and whole families coming to bring donations to drop-off sites. And so our entire city expressed their generosity in trying to picture like what it would be like for somebody from Venezuela who'd traveled with virtually nothing to arrive in Denver when we were experiencing some of the toughest snowstorms across the country. Just really proud of that there. And I know we have other things to improve beyond what we've heard here. But thank you all for plugging in so deeply and doing it with such dignity in mind for the individuals that we're asking for help. There were other locations willing to temporarily offer shelter, but for various complex reasons could not. We do have to look at code regulations, and I think something for us to pay attention to in the coming months. So I thank you all. No one else is in queue. Thank you very much for such an in-depth briefing, and to my colleagues for just tremendous questions and conversations. So thank you, everyone. We're adjourned.